Yeah, they always give that in facilities, right? You've heard of prednisones. Yeah, atrovents. Yes, definitely. Another thing that they have to, we have to look at are the inhaled steroids. Look at the inhaled steroids. Beclomethasone with a meter dose inhaler, MDI, and nebulizers, which our respiratory techs usually give, right? A board favorite is anybody getting inhalers made of steroids can cause fungal infections in your mouth. Yes. So what do we do after? We rinse the mouth after those. So there, you kind of know already what they're going to ask in the boards. Again, let me recap. They're going to ask you what are the rescue meds, the one that will work immediately, short actings, right? They're going to ask you what are the daily meds. And then the daily meds, you would see, obviously, they do not work on the acute episode. Xolair in the very bottom is used for children older than 12 years. Injections given every 2 weeks based on the immunoglobulin E levels. That's an allergic type of asthma. The IgE is for allergies. That's elevated during allergies, right? 0. Very good. Well, you are on the right track. Good job. All right, so we do have some drugs in the next page. Can you at least know some of the theophylline interaction on the next page? So I'm probably just give you 5, okay? I just marked 5. I need you to look at antibiotics versus theophylline. Are they good together? Like antibiotic erythromycin. So, baby John John. Why do they name babies twice? John John. No? Rap rap. Rap rap. Right? Why do they name babies? Boy boy. An. An. Anyway. Can erythromycin marry theophylline? No. So that's number 1. Can Cipro elope with theophylline? Significantly, they're not compatible. Tagamet. Yes, no. I'm just giving you 3. Oh, you can't even take it when you're on oral contraceptives. In other words, I'm just picking the ones that can increase. Okay? And don't like high-fat foods. But I'm going to put a star there because I read last night that, see, the high-fat foods and theophylline, they're not compatible, right? Yes? No. Increases absorption of theophylline. Are they compatible? Or are they? Or you want it? Why not? It's good, right? It increases absorption of theophylline. But you don't also want to increase the fat. If it's, you're right, don't overdo the fat because normal, yeah, normal. Or it does say have fatty foods, but don't take too much of it. Do you remember in our lecture before that kids need a fat diet? Maybe lecture. I didn't lecture GI with you, but I know we did high fat diet in seizures. Ketogenic diet, very good. So we do have 2 occasions where we like the fat in children. One is for the seizure and one is for the asthma. Did you get it? In seizures, we want them to be on a high-fat diet if they are on seizure precautions in there. In asthma, we also want them to maintain a high-fat diet if they are on theophylline, so theophylline can be absorbed. So we have to wait for the story. When were you smelling your menu? You want that? You're just imagining. Okay. Let's flip the page back to 591 before the table. So we start with the nursing care. Please look at the nursing care. It's very self-explanatory. We tell the child and the parents to have the child avoid pet dander. That's why if the child, here's another board question. If the child wants a pet, see, you already know what the board will ask. Pet, P-E-T, pet, or P-H-E-T, pet. Right, Dan? Pet. From your country? Your place, where you from? Oh, what kind of pet?
A hairless cat. Hypoallergenic.
I didn't expect that. A hairless cat.
Like the one Obama, the first dog.
You know what? That is the one that came out. Goldfish. Fish pet. Why? A fish can be a pet? Yeah. All right. So, but there was no another question. There was a dog in there. Can you have a dog if you are asthmatic?
Yeah. The Obamas, their dogs.
Yes. That don't shed.
Yeah, like a Yorkie.
Yeah, Yorkshire. Yep. All right. So there, avoid pet dander, hair, mold, smoking. Read that please on your own, and then you humidify your house or your place of wherever you are. I have a nephew who has, I think he's better now. He used to have bad asthma, so their house should be wood, so they had to change the carpets. So no carpets. On the right side of the book, do you see HEPA filter there?
Yes.
HEPA filter.
Yes.
Yeah, I remember my old house. No, not old, but my house before this house. Part of their marketing was they were selling me the HEPA filter for the entire house, and that's another $10,000. And I had to sit there and go, why do I use? But it sounds nice, right? My house would have no. But it's $10,000. So I go, you know what? I don't have asthma. So I did. She was laughing. Oh, okay. What? That's $10,000 one. But then it is very good. Oh, HEPA filter. It vacuums the dust and everything in your house. But I didn't get it. Anyway, that's a HEPA filter. And but they do this in new homes. When you have new construction homes, it will be plugged into the upgrades. So I said, I don't need a HEPA filter. I need a new jacuzzi in my bathroom. I spent the $10,000. No, actually, I didn't get it for jacuzzi. I got it for the balcony in the back of my room. That was $10,000. Which I never used. There's nothing there. It's just a whole. All right, page 593. Spending money. 593. On the very top. Okay. On the very 593 left side, they always ask for activities for children. 593. That is allowed for children. That in this case, asthma. Swimming is everybody's favorite in the board exam, right? Because you don't have to exert a lot of effort. Another good exercise we need to teach the kid is pursed lip exercises, and we do that because in pursed lip you are exhaling twice or 3 times longer than inhaling, so they have to do it like blowing. Sometimes you don't hear the word pursed lip or see it on the test. It will be a question something like, what activity would be similar to exercising or doing pursed lip? What? No, seriously, that's the one that came out in the board. Because just like what I said in cardio, you don't necessarily see Hohmann's sign, right? They'll tell you, how do you explain Hohmann's sign to a lay person? You don't say dorsiflex the leg. You can say point your toes toward your chin, right? Or you could see point to the stars or wherever it is you want to point. Point your toes toward your head. So it might not be that word. So I tell you which one came out in the board exam and tell me if this is good. The boards are so smart, no, people? That's why they invited me. They did, and the test, to write the test questions. But it was in Boston, and I didn't want to go because it's too cold in Boston. They do invite professionals to write questions, and it's a whole process. Did you know one question in the boards, how long it takes to make it?
2 hours.
Try. Cold. You're very cold.
A day?
Very good. It's a day for one question. And they sit there the whole year just to make a whole test. And that's why they do it every 3 years, not every year. So difficult to make questions. You have to make sure it's evidence-based, make sure you have books to support it, make sure you have actual research to support it. So they send the invitation to teachers and here in the school, but I declined. I said I have to teach VN 89 and 91. I cannot. So going back to the boards, how do we How do we do pursed lip? Breathing. But the word pursed lip is not there. What exercise can we teach the child? Okay, so
Exercise
okay. This is the one that came out in the book. What? Pretend, tell the child, it's a toddler or a school. Pretend you're blowing a candle on a flashlight. Flashlight. Pretend it's a candle and blow it. That would be so right? But you have to, as a nurse, you have to turn it off outside the flashlight. The child will be so mad at you. I've been blowing, it's still on. Harder, honey, do it. I'm not kidding. You're fine. You don't believe me? Flashlight, blow it like a candle. It's pursed lip. So you may not see pursed lip there. You have to be age specific. You have to play, kick ball outside. You have to convert it into something they can relate. You think they will understand pursed lip? Are you kidding me? 2-year-old kid, 3 years old? We don't do pursed lip for 3 years old. We do blowing candles. Pretend it's your birthday and you have this little flashlight there. And you blow them one by one. Right? Okay. Alright. Stop. Why are you laughing? Alright, page 593. Hindi pa nagbasa to. I don't even read this part. What if I read the whole thing? I would be so crazy. Alright, next. Questions? Can you read asthma? Asthma, please. Read it on your own, okay? I want to show you page 595 for a minute. 595. This came out already right below the meter dose inhaler. How do we know that the canister is already empty, like in nitroglycerin? Let it float. It's right here. Let it float in a basin of water. Okay, so read that part. And last but not the least, status asthmaticus is when they have wheezing that does not go away. It's a medical emergency. So it's like asthma episodes with no rest periods in between. So they're gonna, of course, be DED if we don't take them to the hospitals. So complication will be status asthmaticus. Okay, the last one. I have how many more? Cystic fibrosis. We did cystic fibrosis in not fibro. Immune system, was it? Not immune system? All right, immune, but cystic fibrosis, if you remember, let me just tell you the ones we need here. You will have the whole weekend. You have no excuse to stemplang the test on Thursday. VN, stemplang, fail. VN 91 will probably have only one night, but I guess they're reading already ahead of time. No. So everybody has about a week to read in advance. So no reason why you will not be able to answer this. So cystic fibrosis, remember? What first comes into your mind, cystic fibrosis? Mucus, right? Lung, because it's a disorder of the exocrine glands. First paragraph, just in the middle of the first paragraph, it's chromosome number 7 that is affected. So having said that, when I say chromosome, it's a gene problem.
Yes.
It's right? So we know, okay, get that out of the way. I don't care about the 1 in every 2,500, and I'm going to ask that. But I know it's chromosome 7. Did you do Down syndrome with Dr. Helen?
Yes.
Yeah, so you had a chromosome 23, right? 21, 5, or 7. So this is also 7. The basic defect in cystic fibrosis is the exocrine gland. That's why you had the mucus thing that affects multi-system. So several systems, but the main problem on the mucus here is that they become sticky and thick, and because there's a lot of excess mucus that's coming out, they lose electrolytes with it. So there are 2 complications we watch for: thick mucus and loss of electrolytes. But what particular systems? You have 4 major systems that are affected. One is lung, at the bottom. Second is GI. Third is skin. And the fourth is reproductive. So let me just briefly say on the respiratory. On the respiratory, if you have accumulation of thick secretions, you're going to look for respiratory signs and symptoms, right? On the digestive, you're going to look for the GI tract that's blocked. That's why you're not able to metabolize and use up all the nutrients because the GI system is blocked. On the skin, you're going to be losing the electrolytes. You are excreting a lot of sweat. And with your sweat goes out your sodium also. And the last one in reproductive, your tubes in your reproductive tract will be blocked also. That's why it's difficult to have a baby. It's difficult to have an erection for guys probably. So they're all about a blockage somewhere. So when you look at the manifestations, you have to look at it per system. So in the first one is lung involvement. That's under respi. Do you notice that they're going to have atelectasis eventually? And then you have a barrel chest, like they have COPDs, and then they're clubbing of the fingers. Those are signs of low oxygenation. So respiratory, for me, is kind of easy. I know that they're going to have a lot of phlegm, a lot of mucus, and it's all going to be CO2 problem, cyanosis, clubbing of the fingers. I would even put here cardio. Do you think eventually they'll have a cardio problem? Yes. The heart needs to pump harder, right? So see, we're even better than our book. The book only focuses on the lungs. So we have the dyspnea and the wheezing and the cyanosis. On the GI part, our problem is the pancreatic involvement. The pancreas will be there in the stomach. It will be plugged by the mucus. So the child is not able to release the enzymes needed for digestion, metabolizing the food, fat, or anything. So when you look at the second paragraph, because they're not able to metabolize it, the second paragraph, they will be pooping stools that may be FFF, foul, frothy, fatty, 3Fs. Yeah, not here, but I know it's 3Fs. Foul smelling, frothy like bubbles, and foul smelling. What do we call that stool again? Cappuccino latte, what? The 3-layer sputum was bronchitis, but this is a stool we're talking about.
Oh, stool.
Come on. They're pooping a lot. Their butt will be wasting away. Oh, was I like this before? I don't have butt. The butt disappears and the main fat deposits. What do we call a fatty, frothy, foul-smelling stool? Where's your turn? Very good. Steatorrhea.
Wait, you said foul from
Foul, frothy, stool. Foul, frothy, foul-smelling, fatty. Fatty, frothy, foul-smelling stool. It's steatorrhea. Why do I say that? Because I said when we go to the boards, we only shoot for the ones that are commonly seen in patients, commonly asked in the boards. That's why we have a good passing rate. What do you think? Of course, we tell you what to look for. Plus, you don't see everything, the little details, unless the client is really very sick, which they don't put that in the boards. They don't put a very sick client in the board exam. They'll put a mildly sick client and even the normal client. So for the cystic fibrosis, we're going to look for foul, frothy, foul-smelling, fatty stool, which is called steatorrhea. Okay, that's on that paragraph. Since they're pooping a lot, they're going to be wasting an thigh atrophy in the buttocks also. The third paragraph is because the GI tract is blocked by the mucus, they could have a blockage, which is called meconium ileus. That's why if you remember in maternity nursing, we didn't want to discharge a baby until she pees or poops, right? But she doesn't have to do that in the first 24 hours. But before we discharge her, we need to make sure that it's not plugged, like this one is a condition, meconium ileus. In the very bottom of that paragraph, the absence of stools and the presence of vomiting and abdominal distension could lead to a suspicion of intestinal obstruction. That's why we need to have an x-ray before we even send them home. Okay, so to summarize on the GI, we look for pancreas. Enzymes are not released because of the blockage. They will be pooping, fat, fatty, frothy, foul-smelling stool, cytorrhea, and there may be blockage in the GI tract, which we call meconium ileus. On the skin, you're going to be sweating a lot, and the sweat, the tears, the saliva will abnormally be salty because of the loss of electrolyte, particularly sodium. Now, how do we know it's happening? We will do a classic board question, sweat test. How is the sweat? Right side of the book. Sweat test is done. We're going to get a sample of the patient's sweat. The normal sweat level is 10 to 35 sodium in the sweat. The normal sodium in the sweat is 10 to 35 mix. So what is the abnormal now? More than 60 is diagnostic of cystic fibrosis. Let me say that again. Normally 10 to 35. If you're losing 60 or more, it's diagnostic of cystic fibrosis. Right? Why do you think they sell Gatorade nowadays if you're in the gym and you're really losing a lot of 35, a lot of sweat, or you're sweating a lot, to replace whatever you're losing? Okay, how is the sweat test done? How do we make the child sweat? Huh? The sweat test is really, it's a good thing in the absence of, problem is they're so tired, they're sick, right? So the sweat test involves air. We put electrodes onto the skin, electrodes that will and put the medication pilocarpine. Pilocarpine. You don't have that in your book. I have it in mine for some reason. I did. Pilocarpine, which will stimulate the sweating. After the sweating, there's a lot of sweat, right? You can either put a gauze underneath or a gauze on top, collect the gauze, and put it in the lab, and they weigh it. You will weigh it in the lab and see if it's more than 60 milliequivalents per liter of that. So what is our preparation? We tell the mom that this child will have the sweat test. They'll put an electrode. Doesn't hurt. It just makes you sweat. And we collect the sweat in the gauze, and then we send it to the lab, and they will measure how much is there. So 60 or more is diagnostic of. So in this case, the same paragraph, because the child loses large amounts of salt during perspiration, during the test, right? What should we do for that as nurses? Is that the book says you watch for heat prostration or heat loss, right? So what should we do as nurses? What should we provide? Fluids, extra foods, fluids, electrolytes, salts should be provided after the test, and especially during the summertime when it's very hot. And that's the only thing. Those are the things that they will ask in the boards, and not the very hard details about CF. Complications. Let's go for complications. Rectal prolapse is one. Liver nodes, heart and lungs will be affected also. So our treatment. We give antibiotics. I'm marking my book right now. The next page. Okay, antibiotics. We're concerned about their lungs, right? Is the lung the first organ affected? That we were concerned about. So they may have nebulizers also. Aerosol treatment. Pulmozyme you would see in the next page, please. Another board favorite for CF or cystic fibrosis is postural. Okay. This child has cystic fibrosis and he's scheduled for a pulmonary toilet. What is a pulmonary toilet?
For drinks.
What is a toilet? What does a toilet bowl do? You flush it, right? So sometimes you would see, I'm on page 599, second paragraph. Postural drainage, right? Sometimes they call it pulmonary toilet, which means you will reposition the baby upside down or different positions on the next page you will see, right? And you will tap the back to drain the mucus out. And that's why we said lungs very important involvement here. We did discuss this in adult nursing, right? The postural drainage. What's the position of the hand? cupped hand, right? But in children, you see a lot of questions in pediatrics. You can use that, the mask that we use for the baby's oxygen. On the next page, we remove it from the tube, and that's the one we use to tap. It provides the best shape and size of the cup, the area. So you can use the infant percussion device. It's like a nipple to me. And then we position the baby several ways, up and down, side to side. Okay, we have a trick. I know in nursing school I don't know with you, but in my time we didn't want to memorize a lot. If we could make it easier to remember, I would go for the easier versus the harder, because I always want to go somewhere else after studying, right? You don't want to be studying. So here's the trick. If the question is lower lobes, you want to put the baby upside down. I mean, like this one, position upside down, head down. And so you tap there. But if the question is to drain the upper lobes, all you have to do is sit them up semi-fowlers. Up is up, down is down. Versus some people are like, my classmates were memorizing, so they should be like this. They should be in the lateral, something. No. If the lobe you're draining is in the bottom, all you have to do by gravity is put them upside down. I don't need to look at the pictures. If you're draining the top, since it's already here in the top of the lungs, just semi-fowlers and then top them from the back. So this, every time they show a picture of postural drainage, they show a lot of positions, which in reality don't really follow. We don't follow this. We just follow either up or down. And use the cup hands. So that will be your page 599, second paragraph. I do want to point out something. Since we're in pediatrics, if I'm the one teaching this in adults, I would stop there. But this is pediatrics, right? Do you think this is fun for the kid? Do you think? We always want to do it in a playful manner, in such a way that we are just playing. So how do we accomplish this upside down thingy? What exercise, what activity does a child, I know my niece likes a lot. She goes to my room and does it all the time. Exactly, tumbling. Cartwheel, right? You don't believe me. Page 599. Look at that same paragraph, last 4 lines. General exercise is good for the patient because it stimulates coughing. So play activities such as somersaults and headstands within the child's endurance limits are therapeutic. We always want to put therapeutic play, as part of our nursing management. How many plays did I tell you so far in the last 25 minutes? I told you about blowing the candles, right? Because I'm not impressing you. I need to impress upon you that you need to include the play when you study for pediatrics. Okay? So that's a part there where I put cartwheel on my notes. Next is first lip breathing again. I already explained that. And then the last paragraph is the pancreatic preparation. You have pancrease. I think that's a letter S, should be. All the pancreatic enzymes, board favorite. Last paragraph, please. When do we give it? When do we need the pancreatic enzymes? After eating. When the enzymes we need after we eat. Otherwise, the food that we eat will not be absorbed. So what is our parent teaching here? In the middle of the paragraph, well, it says first 2 lines of the paragraph is given with each meal and snack, right? But in the middle of the paragraph, it does say, what if the child is sick and she's not eating a lot? And she's not eating at all? Skip the enzymes. But what if she's eating sporadically, like eating sometimes she's not eating, sometimes she's eating little, sometimes she's eating a lot. So when do you give it? You give it at the biggest meal. So if she's just snacking a little bit, 1 snack, 1 piece of chocolate, you don't need a pancreatic enzyme there. Did you understand what I just said? Normally, go do it with each meal. Right? That's a major concept. The second one is if they're sick and not eating at all, no need to give it. But if they're snacking in between and they're sporadic, the schedule is not consistent, they're not consistently taking the exact amount of food, just give it with the biggest meal. which for them may be dinner. I don't know. I have to wait for the story. Okay, so right there in the bottom. All right, the rest you can probably read on your own. Oh, before we flip the page, on the very bottom, right on top of emotional support, why do I need the last sentence? Genetic counseling. The very bottom.
Because it's genetic.
What gene were we talking about? What problem? Chromosome number 7. Very good. So that's your assignment there because we already did that. Finally, we have SIDS. What is SIDS? Sudden infant death syndrome. What is it? What is it about? What's happening here? They suddenly die. What's the cause? Yes.
Unknown. Genetic counseling, when does it come? Is it after the couple?
Yeah, in case they want to get pregnant again. But this one we can't do anything anymore. The child is already sick with cystic fibrosis, right? But we don't, in case they want to get, in the future, they want to get pregnant again, and they have to, like, I give an example. I had a classmate that had a baby with Down syndrome. So the baby's already born. The baby actually died 23 hours later. After so many days later, after that, we went for a consult with a geneticist. And they showed us what chromosome was affected in her. Because she wanted to know if it was her or her husband's side. So that's a genetic counseling. Like, do you still want to have a baby? So the doctor said, if you want to have another baby, there's still a chance that you will have the same problem. Yeah. So that child was born here in Hollywood Press. When is Suri's birthday? April 23. Suri! You don't know Suri?
Tom Cruise's kid.
Tom Cruise's girl. Yes, you're right.
Yeah.
She was born the same day as Suri because all the news was about Tom Cruise, and here I was in Hollywood Press. Going back to genetic counseling, that's what we did for the future baby.
Because I noticed that this is prominent with the whites, cystic fibrosis.
Yes.
And people keep having it. If genetic counseling can actually do something about it,
Yeah. Why people don't go for genetic counseling? Do you know? It's very expensive. The reason why we went was because during that time we went, it was free. LA had a drive, free genetic counseling for couples that had problems. So that's why my friend went. She and I went. But it's not a normal test like RBC, CBC's thing. It's, almost free, very cheap. Genetic counseling, you have a geneticist there. They have their own office, and they'll show you the way how the chromosomes are arranged and everything. It's a expensive exam. Okay, so when do we say SIDS? What is the cause of SIDS? Unknown. What are the contributing factors? When you say unknown, what do you mean by unknown? So, but how come the book says the cause is sleeping on the belly, or they stop breathing and there's an occlusion, or there is a cardiac arrest, or there is a what? Okay, we only call it SIDS if everything else has been ruled out. That's the one that I didn't see when I read last night. I read this again for the whatever time. But I didn't see anything that mentions we have done, as long as all the tests are negative and ruled out, that's the only time you use SIDS, the word SIDS. It's the appropriate definition of SIDS. You cannot say SIDS is the cause of death if there was, let's say, for example, apnea secondary to a brain tumor. That's not SIDS, even if they suddenly died while sleeping. Okay? SIDS is when they don't know, the autopsy does not reveal any cause whatsoever. So that's why when you read the book, it will say there that, well, start from the top, it peaks in between 2 and 4 months, more common in boys, more common in the wintertime. That's just statistics. That's when it happens, right? And then you go to the second paragraph, they were sleeping in the same room. They go and you look at before the paragraph ends, overheating, irregular respiratory patterns. Those are contributing factors, but those are really not the cause of SIDS. Nobody really knows what is SIDS, and that's what makes it unfortunate. However, there is a strong relationship in babies who are dying and because they were put on their bellies, prone position. That's why they came up with this program called Back to Sleep program. Back to sleep. Their back should be, they should be on their back when they're sleeping. That's one. Number two, a common finding they have is using a soft mattress. So you have to be on a firm mattress for children. You know it's firm because they're not sinking on the mattress. There should be no pillows, no nothing, no toys around the cribs. Where it can help to have an apnea monitor at home, right? O2 sats whatsoever, but nothing can prevent SIDS. It's going to happen, it's going to happen. And that's sad, no? 6 months your baby was born healthy and then suddenly dies at 6 months. So you can read this on your own. Nothing to discuss. Unknown cause, unknown treatment. They're already dead. What can I do? Right? But what is the prevention? What is the, they say that can prevent. Put the baby on their backs when they're sleeping. Put them on a firm mattress and don't put pillows around or any toys or any stuffed toys around. It should be clear. Okay? So that will be the end of your breastfeed. We take a restroom break. I still have to finish cardio and lymphatic, blood before we watch a movie if we still have time.
White one.
Angelica.